Today was a day where we were celebrating the walk. Brett Kiesel was here to connect with 5 children. They each got a medal. It was so exciting to see them walk up on stage. He talked to them about who they are, what they like to do. His relationship with Children's Hospital has been there for so many years. And we are so grateful for Brett and that all that he brings, his time, his talent, and connections with our kids. It means a lot.
It's fun for me today to get up on stage. I get to kind of get to know them a little bit by asking them silly questions and find out about their life, what they like, and recognize these champions as we gear up for the Walk for Children's on June 4th.
In our 7th year, Walk for Children's helps to raise money that supports programs at UPMC Children's Hospital, like child life, supportive care, some of our community outreach initiatives, and most importantly, the research that happens to advance science and medicine to help us find cures and new treatments for childhood diseases. We couldn't do it without a fabulous community of supporters, and I hope that you will join us on June 4th at Schenley Park to Walk for Children.
I'd had him a couple days prior and then came in and had him again and just noticed that, some things had changed. Him leaning to the left was kind of what really seemed kind of off and just what he wasn't doing prior. So I just wanted to make sure, notify the doctor and just notify him of that change to make sure everybody was, on the same page. They found that he actually had a large subdural hemorrhage with a midline shift. So he had bleeding on the brain, that it actually was getting so big that it was actually starting to push his brain to one side. And it should be center, and it was starting to push the brain to the other side.
We feel that Amanda is definitely his guardian angel.
Yep.
Definitely. They saved his life, and we can't thank them enough.
I became a nurse to help people, to make a difference in their life, so it was really awesome to be able to know that I was able to make a difference in his life.
I can't tell you what an honor it is to be here today to stand witness to the evolution of this project. The need for withdrawal management and residential addiction treatment has grown exponentially over many years. With the addition of this project, UPMC Western Behavioral Health at Twin Lakes will increase bed capacity by 60%, helping to cover an ever-growing service area, which now includes southwestern Pennsylvania. Additionally, 26 new jobs will be created. Thank you all for your support and for your presence today. We look forward to the completion of this project to continue providing outstanding services touching the lives of even more families. Thank you.
1, 2, 3. Today we are taking all of our junior high middle schools and bringing them together here today to compete. We think keeping kids on the right track is huge. Athletics makes that possible a lot of times. Kids can get themselves in trouble when they're not doing athletics. So we want to use track and field to keep kids on the right track. So this event today gives our kids to shine, gives our kids to compete against their peers, stay active, stay healthy, which we think is all great. We've had some huge support to make it happen, but here in about a half hour, we're going to have about 100 kids competing in the sport of track and field and hopefully use that to keep them on the right track.
UPMC, keeping kids on track. UPMC, keeping his kids on track.
UPMC, keeping kids on track.
UPMC is working with Kids on Track to increase awareness around obesity. Using running, we keep kids on track and off the streets.